Hey guys, I wanted to introduce you to Dr. Leach. He is the sole practitioner here at Michael J. Leach Pediatric Dentistry. Today I wanted you to get to know him a little bit better, other than the fact that he's just the dentist here. So I'm going to be going through a couple questions that's going to give you more insight on him and let him tell you more about the practice and why you should come here. So Dr. Leach, can you tell everyone why you decided to become a pediatric dentist and on top of that, a sole practitioner?
Well, growing up, once I realized that professional athlete was out of the question, I decided that I wanted to do the medical field. And when I got to college and did biology and chemistry, I really liked that. So I decided I was going to go into either medicine or dentistry. And then looking at the opportunities that were there with medicine and dentistry both, I chose dentistry. And it kind of goes back to when I was in about 5th grade and I had braces myself. And I thought that was a really interesting process and really liked it and wanted to learn more about it.
Perfect. So definitely a science guy.
Definitely a science guy. And as far as the sole practitioner goes, when I moved to Atlanta in 1996, I worked for a large group for about a year. And what it made me realize is that's not really what I wanted to do.
Yeah.
I wanted to be in a situation where I could get to know my patients, to know the parents, and to be, basically have them be part of my family like I was part of theirs for their dental experience.
Of course.
So that's why I chose sole practitioner as part of a large group.
Perfect. So can you explain a little bit more in depth what exactly a sole practitioner is? I know we toss around that phrase a lot here, and we love to say how he's a sole practitioner and how that enhances our practice. But for the people that don't really know, can you give just a quick little snippet about what it is?
Well, sole practitioner for me is that I'm the guy you're going to see when you come here. When you come to get your teeth checked, when you come to get a filling done, when you come to get something done, it's me. You're not seeing one dentist one time and a different dentist the next time and a different dentist the next time. It allows for continuity of care.
Perfect.
And it really is in a situation where I believe in the best interest of the kids, because I do get to do what I wanted to when I started, and I get to know the parents, I get to know the kids, and like I said, get them to be part of our dental family.
Yeah. So that's great. So guys, remember, if you do decide to come here, you will be seeing Dr. Leach every time that you come. He will be doing the dental health checkups at the end, the exams. If you have any questions, he will always be the one you get to talk to, and you can't get that at many other places.
No, and I try to talk to every parent every time we come. I think it's very important that they know and are a full partner in their child's dental health.
Of course, and I can definitely say that he tries to actually get to know the kids. We start seeing them at very, very little ages, and he watches them grow up. We have kids that are just now going off to college, and those conversations, you've seen them grow up, basically. And I think that that's really cool.
It is really cool. It's a situation where I kid with the parents and say that they're getting older, but we're not. But I've got to see them go, basically grow up. They've been a part of our practice for 14, 15, 16 years, some of them. And we've got some that are, I'm getting old now. I know when I have my first patients who are coming back and bringing their kids. So now I'm seeing a second generation, and it's really great that they have the trust in me and appreciated me enough when they were growing up that they're bringing their kids back to see me.
That's awesome. That has to be so rewarding.
It really is.
That.
It really is.
Dr. Leach, can you tell everyone about the schooling that you had to go through and the training that you went through in order to become a board-certified pediatric dentist?
Yeah, so I went through undergrad and got a degree in biology. Then I went to dental school at West Virginia University. And during dental school, your experiences include going through all the different specialties of dentistry, but you get a little snippet of each one. And going through that, I really like dealing with kids. Yeah. Kids are more forgiving than adults, and they're also in a situation where their problems are not the same as adult problems are. And I enjoyed the reward of being in a situation where we could deal with kids and have them come out of a visit loving what we have done, and not be in a situation where they may come in scared, but when they're done, they're fine. They're fine and they're happy and they get a prize and they're ready to go. After dental school, I decided that I did want to specialize in pediatric dentistry. So I did a 3-year residency program at Children's Hospital, Pittsburgh. So I spent 3 extra years learning about growth and development, about children's psychology, and a variety of things, plus just treating kids every day, 5 days a week, plus being on call in the hospital there.
Yeah.
And it was a great experience, and I wouldn't trade it.
Perfect.
wouldn't
And
trade it.
kids are more fun, and the prizes. Everyone loves the prizes. You get 2 prizes here, not just one. You get 2.
Exactly, and you know, I was a big video game kid when I was younger. So although the games have changed, I love having the video games in the office for the kids,
Oh, yes.
and helping them play and enjoying that with them too.
It's a lot of fun when they hit the high score, and they like to come around and tell everyone that they beat the high score.
And it's usually my high score, and I tell them I have to spend my whole lunch hour trying to get it back. So
Just gives them a challenge for the next time.
exactly.
So you mentioned that you got to do a couple of different types of dentistry.
You get to do several. I mean, I did
Okay.
periodontics, which is dealing with gums and teeth and bone.
Okay.
We did restorative, which is basically your basic fillings, and prosthodontics, which is crowns, bridges,
Okay.
dentures. We did orthodontics. We did endodontics, which is root canals. We did pediatric dentistry.
Okay.
It was a variety. You had to complete so many procedures in each section in order to be able to graduate.
Okay.
So many patients coming in for so many
Yeah.
procedures to graduate.
Awesome. So going off of that, there is a lot of different types of dentists out there. So
Yes.
there's family dentists, general dentists, pediatric dentists. What makes a pediatric dentist the best choice for kids?
Because of the 3 years of extra training that I've had, general dentist and family dentist, honestly, are the same thing. They're just advertising that they're treating a family. They have no specialized training, the majority of those in kids. They can treat kids until they have an issue, and then we typically end up seeing them.
Okay.
But that's what the 3 years of additional training were for, was to be in a situation where we really learned how to deal with kids, how to manage their anxiety, how to have them have the best experience they could, so they're not afraid of the dentist and aren't in a situation where coming to the dentist is a traumatic experience. The extra 3 years was a big deal. It really was, and I gained experience there that I wouldn't trade and that I couldn't. I mean, I saw things that a lot of people will never see during that 3 years. Plus, now being out and having practiced for over 20 years, I've seen a lot here too. and my practice philosophy has changed over the years. You know, as you get older, you realize what works and what doesn't. So we don't sedate many kids anymore. We used to sedate a number of kids. We don't do that anymore. We can typically deal with kids without having to medicate them to get the work done. So it's a good feeling.
Awesome. And honey definitely helps with that.
Honey helps with everything, with the parents, with the patients, with the staff. She has been a great addition, and
Yes.
the anxiety level in the office has definitely gone down since her arrival. And I think, you know, the kids, to have her there on the chair where they can pet her and
Just snuggle with her and
snuggle with
love
her
on
and
her.
just distract them from what's really going on. If they're a least bit anxious, it's been a godsend for us. I wish we had done it years ago.
At least you did it now.
Exactly.
So if you guys don't know, Honey is our therapy dog.
She is a miniature teddy bear golden doodle.
Okay, yep. From Smeralda.
Smeralda in Alabama, yes.
Yep, so she has come on board for a little over a year now.
Yes.
And so if your kid is a little bit anxious or they just need a little bit of extra encouragement or loving, she loves to come and lay with them and snuggle with them, play, run around. Just love on everyone, including the staff, which we all greatly appreciate, I do have to say. So she has been a great addition as well to the team. Now the question that I know everyone is dying to know, what do you do in your free time?
Free time, wow. If I had a lot of free time, I'd be able to give you a great answer. With having the 5 kids, there wasn't a ton of free time, but when we do get a break and we get a vacation, we love to go to the water, whether it be to the beach or to the lake. The kids love to do water sports, and we enjoy, you know, fishing and tubing and that kind of thing, and going to the beach and wakes, you know, surfing on the waves and just hanging out there.
Yeah.
It's a lot of fun. We enjoy the water. Love the mountains too, but we love the water better. So I think that's probably the thing that we enjoy most, is just getting out of town, being able to relax, unwind,
And connect as a family more. 'cause
exactly.
You don't get. I
No.
mean, they're all over the map. Your kids are. So.
They are, and you know, we still must do pretty decent vacations because they all still like to go. So it's not a
That's
situation
the key.
where they're not bailing out to go with somebody else at this point. So that's a good thing.
Be sure to keep that going.
We're
I
trying.
think that will work.
We're trying.
What is the most rewarding part of getting to work with kids every day?
Well, when we're treating kids, the best part of it is honestly when you have a really anxious child to start with, and you get them through the process, whether it be a filling, extraction, or even a dental health checkup, and that child comes out on the other end and is just smiling and beaming. They've got prizes, and there's this joy, and you realize you've taken something that was a very stressful situation for them and turned it into something that was a fun experience.
Yeah.
And that's what we want to try to do for the kids. We want to make it so that they are lifetime partners in their dental health and that they enjoy coming to the dentist. And we hear often from the parents that it's when I tell my kids they're going to the dentist, it's like they're excited about it, as opposed to being like not wanting to come, which is it's a great thing, and that's what I really enjoy hearing, is they really want to come back.
Yeah, I mean, who wouldn't want to come here? It's so fun. If you guys haven't had a chance to take a tour of it yet, or even one of our virtual tours, which is on our website, we have out here in the lobby, we have this giant aquarium behind us. We have TVs everywhere, a train table, a video game room, separate areas in the back for kids that are, for the treehouse kids that are age
Up to high school.
Okay.
And then we have the teen room for the high school kids.
Yep.
That kind of separates the younger kids from the older kids so that they can watch different movies and do that kind of thing. Because we do have movies that are playing while they're getting their the treatment done. And while the parents are waiting in comfort in the reception area, we've got a coffee bar, we've got massage chairs, so that they can really get that actual break that they never get normally. It allows them to be in a situation where they can sit out here and not worry about what's going on. We'll know what's happening. We'll make sure that they're aware, and we can get their kids taken care of.
Yeah, and the whole team here is so sweet with all the kids. They're great at getting them in the back and laughing and really making those connections with them and genuinely caring about your children. And it's not just another set of teeth that they're cleaning or working on. It's actually a relationship.
It is. And we talked before about the difference between sole practitioner and non-sole practitioner. This is not a factory. A lot of times when you go to a large corporate dental office, you're in a situation where they're more, the number of kids they get through there, the more money they make, and that's more of a situation for them. So it can be kind of a factory feel, and we definitely don't want that. We want your kids to have a personalized experience for them, and that's what we're here for.
Of course, and we want them to love coming to see you. I know that looking through reviews, people have mentioned before that their kids will say, I want to go to my dentist. Like, is it time to go to my dentist instead of just the dentist? So having that ownership, I think, definitely helps them in the process of it too.
Very much so. It really does. One of the things we talked about with sole practitioner and corporate dentistry too, the difference is the staff here is a huge difference, I can tell you. We don't have staff turnover that happens frequently. We've got people who have been here. Shannon's been here over 25 years.
Yes.
And we have people who have come on to help us with our marketing things that have been here 6 months. So we have a variety of people who have been here, but they all, our goal when we hire somebody is to hire somebody for the long term, so that when your kids come, they see the same people over and over. And that builds a familiarity with the office, and they're in a situation where they see the same faces over and over again, and it just makes it more comfortable for them.
Exactly.
So that's one of the things we aim for as well. So they're not different people and different faces every time they come.
Previously, you mentioned that you did your 3-year residency at the Children's Hospital of Pittsburgh. So are you from Pittsburgh? Are you from here? Where are you from?
I grew up about an hour outside of Pittsburgh in a small little town in West Virginia called Glendale, West Virginia. And I went to a small college in Wheeling, West Virginia for undergrad. Went to West Virginia University for dental school, and then matriculated to Children's Hospital of Pittsburgh for my residency program. And we lived there in Pittsburgh for 3 years. My wife Maggie and I did. And then we moved. When I graduated, there was a need in the Atlanta area for more pediatric dentists.
Okay.
And my wife's sister lived here already, so we moved down here. At that point, we had a 6-month-old, and we found out
that was a fun move.
That was a fun move. And when we got here, we were surprised to find out we had a second that was going to be born not long after that. They've since grown a lot. I now have 5 kids. One that has graduated from the University of Georgia, one that will graduate soon from Georgia Tech.
Awesome.
I have one that is a freshman at University of North Georgia, and then I have a junior in high school and a 5th grader. What was
All
that thinking?
over the board.
All over the board. 4 boys and then a girl at the end. So I've been through everything that most parents are going through, as far as raising kids and running the whole gamut with that. And from the point of having some kids who had some learning difficulties and things that I can understand what
Yeah.
what the parents are going through. So, getting older, I guess, has its benefits because I've had a vast experience in a lot of those things. So I can bring that experience here and try to help the kids and the parents as well.
Yeah, and I think that's one of the coolest things is that you are very conservative with your approach to treatment. So if you wouldn't do it on your kids, you're not going to suggest someone to do it on their kids.
That doesn't make sense. I don't know. I mean, I don't know why somebody would do that. It's not you're trying to do what's in the best interest of the kids and the parents, and not try to do what's in the best interest of your pocketbook. And I just don't believe in that. I wouldn't do, like you said, I always tell the parents I wouldn't do it on, if I wouldn't do it on my child, I'm not going to do it on yours.
Exactly.
So,
I think that provides a lot of peace of mind, especially with some of the procedures that if they come in for a dental cleaning and then they find out that they need more extensive work, it gives them that peace of mind of knowing, okay, he's not just trying to sell me on something.
well, and I try to go through everything with the parents. I don't mind showing them x-rays and telling them what we see, and so they can really get a handle on exactly what's going on and what the needs are and why we need to treat that as opposed to just letting it fall out, or where we are in the process with those kind of things.
Well, guys, I hope that you enjoyed getting to know Dr. Leach a little bit better today. We are going to be bringing you more of these videos so you get to know all of our staff because, like Dr. Leach said, we have staff that has been here for years, and we want you to become familiar with them so that when your kids come, they feel like they already have a friend, even if it's their first time. And with that being said, we are always accepting new patients. If you want to visit our website at www.thekidstoothdoc.com, or you can give us a call at 770-521-8855 and ask to speak with our new patient coordinator. She takes care of all of our new patients and making sure all of your questions are answered so that your first visit is as seamless as possible and you are good to go. Thank you guys so much for joining us. We hope that you enjoyed it, and we will see you on the next video.
Thank you.
Bye.
Bye-bye.